This is Dr. Farhad Bolchi with CDOCS, and in this tip of the day video, I will be discussing some tips for guided bone profiling. Now, in one of the previous tip of the day videos, we discussed what guided bone profiling is, but guided bone profiling is basically a very elegant technique and workflow to remove excessive bone around the shoulder of the implant to allow restorative components to seat without impinging upon the bone. So with this technique, we have got a pin that goes inside of the implant, and then we've got a profiler that exactly fits that pin and removes the bone very, very accurately around the implant so that we can seat any restorative components after it's time to restore the implant without the risk of impinging upon the bone and not letting those components seat. And then we can place, as you can see here in this slides, a transmucosal healing cap and then suture around the area until the implant is ready for restoration. However, there are several things that we need to follow when we look at guided bone profiling. The first thing is that we should first try in the guided bone profilers after we have placed the pin by hand to ensure that they don't remove bone or tissue where we don't want bone or tissue to be removed. Because these are round profilers, they're concentric, so they remove just as much tissue and bone on the buccal, for example, as interproximally. So especially if we're doing flapless cases in the aesthetic zone or other cases in the aesthetic zone, we want to make sure that we don't remove too much. So we will try in the profilers and then pick the size that is adequate for the specific case without basically the danger of removing too much. So the first tip is to try these in by hand. And the second tip is that if at the time of implant placement, your implant does not have primary stability, then we should not do this guided bone profiling at the time of implant placement. Because if you do this and the implant does not have the adequate primary stability, when it comes time to unscrew the pin out of the implant, then there's the danger of actually unscrewing the entire implant. So if that is the case and the implant does not have adequate primary stability, we can still place the implant in the majority of cases, but then we should wait until the implant achieves osseointegration before we do the guided bone profiling. So I hope this tip of the day video has been helpful, and please visit us at cdocs.com or visit one of our implant workshops which we teach at CDOCS for more tips such as this or for more detailed discussion of implant related topics.